Good morning, everyone, and welcome you all to the week 6 of part 2 classes by AMCI. And yes, it's week 6, and we are going to cover the chapters from 10 to 14 from ICD-10-CM. Today it includes the COPDs, the fractures, and the skin. So how are you all doing in the Saturday morning? How are you all, and what's the weather over there? So we have changed the format a little bit. We will start up with the pre-class videos where we'll be giving some warm-up scenarios for you so that you get prepared and ready to roll in the class, the meat of the class, which will be followed. So are you guys ready for the pre-class? So let's start, team. Let's start, coders. Yeah, that's the spirit. So as I said, we will be doing some warm-up scenarios with the homework. You will be familiar with this. So let's do it. Yes, and this is your first warm-up homework scenario. For this week, what ICD-10-CM codes is or are reported? Your options are option A, J45.901, R06.2, option B, J45.901, option C, J45.909, R06.2, and option D, R06.2. A 9-year-old with a history of reactive airway disease was admitted into overnight observation with the complaints of 2 days history of increased wheezing. The parents stated that the nebulizer treatment were not helping. After monitoring and additional treatments given while in observation, breathing was stabilized. Documented diagnosis is RAD exacerbation. What ICD-10-CM codes are reported for this case? And I will give you 2.5 minutes, coders. You know the drill. So let's meet after 2.5 minutes, and your time starts right away. That's 2.5 minutes, coders, and let me have a look into the chat. Yes, from what I see in the chat, I can assure you that you all have picked up from where you left last week. You guys were awesome last week with all the scenarios. You're doing an amazing job this week as well. So the correct answer is going to be option B, J45901. And these are your keywords. And I have highlighted them above. A 9-year-old with a history of reactive airway disease, RAD, is what the full form of RAD is reactive airway disease. The patient was having increased wheezing, and the final diagnosis is RAD exacerbation. So you can see there was increased wheezing for this patient in the scenario, and R06.2 is the ICD code for wheezing. So coders, the patient is already diagnosed with RAD, reactive airway disease exacerbation. So do you think we need to code for R06.2, which is wheezing? I think that's an integral to reactive airway disease, right? Yes, it's a symptom. It's a symptom. Wheezing is a symptom of reactive airway disease. And once we have a confirmed diagnosis, are we going to code for the symptoms? No. Yes, we are not going to code the symptoms along with the confirmed diagnosis. So R06.2 is not needed. And if I look, I have three options which is having R06.2. So anyway, R06.2 is not going to be in our code selection. So I can eliminate option A, option C, option D right away. I can delete them spot on, and the correct answer is going to be J45.901, which is coding for unspecified asthma with acute exacerbation. So if you go into the alphabetic index and lead a disease under the disease reactive airway disease, you will find it will take us to asthma. And you have seen the patient is having RAD exacerbation. So go and select asthma with exacerbation. That will give you the code J45.901. So good work, coders. Great job done. So I have another scenario for you all, and I will read the answers first. What the ICD-10-CM codes reported. The options are option A, D63.1 and 18.30, option B, and 18.30, D63.1, option C, D63.8 and 18.9, and option D, and 18.9, D63.8. A patient sees a nephrologist for the B12 injection to treat erythropoietin resistant anemia due to stage 3 chronic kidney disease. What ICD-10-CM codes are reported? So again, your time remains the same. You have got 2.5 minutes to solve the scenario and put your answers in the chat. So your time begins now, coders. Okay, Coda, that's time, and I can see mixed response here. I can see a mixed response between option A and option B. Well, once I complete the explanation, I think you all know where you made the mistake, and that will be a teachable moment. So the correct answer for this scenario is option B, and 18.30D 63.1. And these are your keywords: vitamin B12 injection, erythropoietin resistant, anemia due to stage 3 CKD. So the very important word is anemia due to stage 3 chronic kidney disease, because that's going to drive our answer. So let's have a look into the two codes of D63.1 and D63.8. So if you have a closer look, D63.1 is coding for anemia in chronic kidney disease. Well, if you look into D63.8, it is coding for anemia in other chronic disease classified elsewhere. So what do you think, coders? Which is the correct answer? It must be D63.1, right? Because it's specified we having anemia which is due to chronic kidney disease. And if you have a look into here, look over here, it's also saying erythropoietin resistant anemia, EPO resistant anemia as well, which is exactly the same which we have in our scenario. So D63.1 is going to be the correct one, and D63.8 is wrong. So option C and option D is having D63.8, right? So we can eliminate option C and D on side. And the remaining two options, yes, these were the one which I think most of you were going, option A and option B. Yes, the both the option A and B have having the same ICD code, but the only difference between option A and option B is the sequencing order. So in such scenario, it's very important for us to go and look if there is any sequencing guideline that will drive us to the correct answer. Well, if you have a close look into D63.1, under which the instructional guideline is asking us to code first, first the underlying chronic kidney disease, that is an 18 series, right? So it is asking us to code first the CKD disease and the stages of the CKD. So of course, the first code must be N18.30, which must be followed by D63.1. So given that, I think option A is wrong. So we are going to select N18.30, which is chronic kidney disease stage 3 unspecified, followed by D63.1, which is anemia in chronic kidney disease. So how are you feeling, coders? How are you feeling? Was that a teachable moment? Yes, now you have got that where we went wrong.
All right, coders. I think everybody's ready, okay? We've heard our theme music. We've heard it twice over, and we are ready. We are ready, okay? So, again, this is week 6. We're going over chapters 10 through 14, COPD, fractures, and skin. And I can't wait to dive into this content. And before we do, we've got to do a little housekeeping and give the copyright. Copyright CPT 2023, American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR Chun, AMCI FAB 7, AMCI ICD 10 Flip Tap are trademarks of AMCI. All right, we've got some things on tap. We have just really put together something that we think will be very beneficial to you all, and we've got some new things rolled into there. Of course, it's all new to you all, but Mr. Sandeep and I have taken the time to freshen up some things that are already there and to add a few things that are new. So, for our last class, we went over specific coding guidelines for Chapter 9, Diseases of the Circulatory System, as well as practice coding scenarios to strengthen your guideline knowledge. Goals for today's class, we are going to first review chapters 10 through 14, diseases of the respiratory, skin, and musculoskeletal system. We're also going to practice coding scenarios to strengthen guideline knowledge and bring you one step closer to ICD-10 coding proficiency. And those are our goals. We've got 3 of them. So let's get to it. Coming up is Mr. Sandeep.
Thank you, Mr. Mika. So, chorus, you all are ready. I believe you all are ready, and you had your warm-up scenarios as well, and you warmed up for this one. So, we are going to have a quick review. The pop-up quiz. Yes, the pop-up quiz is back, and let's start. So again, this is a true or false scenario. Your question is chronic obstructive pulmonary disease is driven by complication. So is ICD code for the chronic obstructive pulmonary disease driven by complication? Put your answers in the chat whether it's a true or false. I'll give you around maybe 10 to 15 seconds is more than enough. It's a true or false. Yes, and the answer is going to be true. Yes, it's true that chronic obstructive pulmonary disease is driven by complications. Always watch out for uncomplicated or complicated. Now let's look into the next one. Ventilator assisted pneumonia is assumed and coded as long as pneumonia is indicated. So is it true or false? Awesome. Awesome to see those answers. And I'm happy to see that you again have reviewed all the guidelines. The answer is going to be false. The guideline is C10.D1 and it states that only assign J95.81 ventilator assisted pneumonia when it is documented by the doctor to be ventilator associated pneumonia. So never assume, always follow the documentation. Here we go for the next scenario. Next true or false scenario. Unstageable ulcer is when the base of ulcer is covered by a scar and is indicated in the documentation that stage is not determined. Is it true or false, coders? And yes, the answer is going to be true. You all said it correctly. Unstable ulcer is when the base of the ulcer is covered by eschar and indicated in the documentation at the stage is not determined. That's when we go for unstable ulcer. And the guidelines which we refer is C12.82. Next, true or false scenario. The patient admitted with ulcer documented as healed is not coded. Is this statement true or false? Exactly. There was no confusion on this one, right? There was no confusion on this one. This was pretty straightforward. The answer is going to be true. The guideline which we follow here is C12A4. So when the patient is admitted with an ulcer documentation and ulcer is healed, we are not going to code them. Next one. Unspecified ulcers are coded to LAT 9 point slash slash O. Is this true or false? This took a little bit while. Maybe you all are checking the book. So the answer is false. Unspecified ulcers are coded to L90, L89 slash slash 9. Good job, coders. I saw that you took some time, and I believe that's for referring the book. So the next one. When coding evolving ulcers, we only code the highest stage during the admission. Is this statement true or false? Yes, I was waiting for your answers. And the answer is going to be, is this true or false, coders? And there's a note that please correct your MCG manual. And I saw someone also place it in the chat that on the MCG it's different. So when coding the evolving ulcer, we are not only coding the highest stage. So this statement is false. There are two codes that are required while coding the ulcer, which is evolved into a higher stage. So the code first one is going to be the stage on admission, which is POA, that is present on the admission, and we are going to code the second code as well, that is a higher stage, which is the stage during the admission. So one, it's a stage on the admission. Second, first one is going to be the stage, the ulcer stage on, which is present on the admission. Second is the stage which is during the admission. So if it is evolved from stage one to stage two, you have to code the stage one first, followed by the stage two. And it is also important to note to make these changes in your MCG manual. Yes, probably yes. it is an inpatient only. So if the patient, it is also saying the patient is on admission, right? So admission cases are inpatient. So don't forget to highlight or change this in your MCG. So let's move to the next one. Okay, I've seen someone asking, I don't understand that very well. Okay, I will repeat again. So if the patient is admitted one, for example, it's a stage one ulcer that is present on the admission when the patient has come to the hospital during the admission, and later on after the admission, the stage is evolving. The stage of the ulcer is evolving to a stage two. And then in such scenarios, we will be coding two codes. The first code will be the stage that was present on admission, that is stage one. And the second code which you have to assign is a higher stage during the admission. So it evolved from stage one to stage two, right? So the second code will be the stage two also as well. Is that clear? Okay, we are good to go. Great. So once again, I have to emphasize on the fact that please correct this in your MCG manual because it's different. So the next true or false scenario, a fracture that results after the acute phase of an illness is called pathological fracture. Oh my God, I've started receiving the answers before completing the question. So you are guys are so good on this. Anyhow, I will wait for remaining of the coders to put the answers. Yes, and the answer is going to be true. Exactly. So the guideline which we follow is C13.C, and these are coded to chapter 13. So a fracture that results after an acute phase of illness is called as pathological fracture. So coming to the next one, the pathologic fractures and acute fractures can be coded in the same setting for the same site. Is this statement true or false, coders? And this statement is false. And the guidelines is I don't know. Yes, I don't know have the guidelines over here. So it's the false. The statement is false. So the pathological fractures and acute fractures are never coded together in the same setting for the same site. So let's move on to the next one. Next true or false scenario. When coding for the chronic kidney disease, if the both stages of the CKD and ESRD are documented, we are only going to assign the code for ESRD. Is the statement true or false, coders? And this statement is True. So when coding for chronic kidney disease, if the both CKD and ESRD are documented, we are only going to code for ESRD. So ESRD is its full form is end stage renal disease, right? So this is end stage. It's a more final, like it's more the severe stage. So if you're having a CKD and ESRD, we are only going to code for ESRD. And the guideline is C14.A1. So I think it's Mr. Mika coming up. Isn't it you, Mr. Mika?
Yes, it is, Mr. Sandeep. Thank you so much. And I tell you, I do believe that they're ready. And I don't want you guys to have any concerns about that evolving ulcer because we've got you covered. Okay. And so that is on me. That particular slide. I saw some people were like, so is it false? What is it? It is false. Okay. That particular one is false. And so let me share with you all because I, again, that one was on me. Okay, so that should have been much clearer for you guys, and I'm gonna move back on that one. And this one, it is correct in the 2023 manual. Like I said, we're doing some housekeeping and updating some things, and so this one is on me. This one here, just as Mr. Sandeep read it, this is false, and the reason it is false because we don't only code the highest stage during the admission. You're going to need two codes that are required. So you're going to code the stage that is present on admission, and then the highest stage during the admission will go second. So if a patient comes in and they have an ulcer and it is a stage 3 and the highest admission was a 5, you would not only code the 5, you have to code what the stage was on admission. So you would capture the 3, the stage 3 first, followed by the stage 5, which was the highest stage. And you have to always remember as well, when you are dealing with admissions, you are coding for what brought them there. So that particular stage that they were at, that's what brought them there. They had that on admission. The other reason, think about it like this, that you would not only code the highest stage is because the ulcer is evolving. So you need to capture both in order to see what that ulcer has done. Does that help to make sense? And again, that is on me. Okay. So we do have some scenarios. So no worries. I've got a scenario for you. Mr. Sandeep and I both have a lot of yumminess in store for you. So don't worry. I don't think you guys are worried. You know we've got you. And Mr. Sandeep, he was serving up some breakfast and stuff, and I'm going to continue on with the breakfast too, Mr. Sandeep. So thank you for that beautiful presentation and for getting them ready. And we're going to continue on with diseases of the respiratory system. We're going to go over COPD and acute respiratory failure. And just kind of brush up on a few things. You all know you get the meat of the lecture with your homework, and you come here and we kind of fine tune some things. So I want you to keep in mind these particular key terms and definitions. Acute exacerbation. This is a worsening or decompensation of a chronic condition. So keep that in mind. If you see the word that the patient, they have decompensated COPD. That means it's getting worse or it's an exacerbation. So these are things that need to become a part of your working knowledge. If it's not, make note of it in your manual. So when you see these things, it clicks. If you see asthmaticus, this is a severe intractable episode of asthma. It's not being responsive to normal therapeutic measures. And I can tell you that it is a scary thing to see a patient have asthmaticus, okay? Because they're not responding and they're not moving air very efficiently, and everything you're doing and throwing at it, it's not moving the needle. So just know that this is serious business, okay? All right, so What about respiratory failure? You want to pay attention to these three things. And I always tell you, get over there in that chapter, see where these codes live. So pay attention to acute. That will be when you're coding J96 point something. If it's chronic, it's going to be J96.1 followed by something. If it's acute and chronic, it's going to be J96.2 followed by something. Now, I know some of you might be like, I got the acute, I got the chronic, but that acute and chronic, I don't know about that. Okay. So, are some of you wondering about that? Like, are they sure? Is that a misprint right there? It's not. Okay, so let me put this in perspective for you. If a person has chronic COPD and they come in to the ER, they're having an acute episode of an attack. Say they have asthma along with it. They're having an acute asthmatic attack. Then you can see how they can have a chronic disease that's with them, but they're having an acute episode of something that's brought them in, that's tied to it. Okay. All right. So let's go ahead and keep on moving. So let's move through some flip exercises. I know you've got your manuals ready. Okay. And let's do this. All right. So we have for our answers A, J96.02, B, J96.01, C, J96.12, and D, J96.22. A patient is seen for acute respiratory failure. She's found to have elevated carbon dioxide in the blood and low oxygen levels. She is diagnosed with hypercapnia. All right, coders, you have 2.5 minutes and your time, it begins now. All right, coders, I see a lot of good things in that chat. You guys are working and the answer is A, and many of you got there. Some of you needed a little nudge and you figured it out and you were like, never mind, it's A. That's what we love to see. So we're going to use this guideline here. You're going to make sure you are really referencing your guidelines and your sequencing. So, acute respiratory failure as the principal diagnosis. Okay, so they have acute respiratory failure and they've been diagnosed with hypercapnia. So, we can take a look here, acute respiratory failure, and we can look here with our tap. We know that it's going to be 96.0 something. All right. So knowing that, what can you immediately eliminate? If you've got this tapped and you see acute respiratory failure, let me go and reference my sequencing. Let me go and reference my guidelines. So that means that J96.1, that's referring to chronic, okay? Because this is just giving you really just giving you the framework. You're going to have to go over and see where it lives in order to complete the code. But this is getting you into the coding category. J96.1, that's going to be chronic. If it's J96.2, that's acute and chronic. Think two. I need two, acute and chronic. I need one that is chronic, and then acute, it's zero. All right. So we're going to take a look. Knowing what our guidelines are, we're going to go ahead, like I said, and eliminate C, J96.12. We can eliminate D because it indeed is acute and chronic. We don't even have to see the specifics of it because we know based on those first four characters that that coding category is not where we need to be. Therefore, we're going to move to A and B. This is where we need to look a little closer because here, based on what we know, J96.0, that is acute. So let's take a closer look. Well, J96.01, that is acute respiratory failure indeed, but it is with hypoxia. That's not what this patient has. This patient has hypercapnia, and therefore J96.02, acute respiratory failure with hypercapnia, that is your code. And you guys were on it. And now you know that if you just missed it, okay, I had a few sprinkles of other answers in there. Get over there with those guidelines and let them push you towards that answer even quicker. All right, so let's move along to our next one. We have A, J45.20, F 17.200, B, J45.31, F 17.210, C, J45.30, F 17.210, and finally D, J45.30, followed by Z 72.0. An asthmatic patient presents for a checkup. She has mild persistent asthma that is currently well controlled. She does, however, continue to smoke cigarettes. She states that she's tried to quit but just can't. She's dependent, having smoked for 25 years. All right, coders, you've got 2.5 minutes again, and then we are going to talk about this. All right, coders, we're going to talk about it. I see some good work in that chat. Yes, the answer is C. Yeah, it is C. Okay, so let's go ahead and take a quick peek at it. So for your keywords, you have mild persistent asthma, well controlled, smokes cigarettes, and dependent. Okay, they're dependent on these cigarettes. So let's start taking a look at what we have. We start with J45.20. And this is incorrect because it's mild intermittent asthma. This patient has mild persistent asthma. And remember, when you're coding, that's what it means to be forensic because one word can change your code selection. It sure can. So make sure you're looking closely. If you need readers or glasses, I know I have my readers, and don't judge y'all because I'll go in there and get a 2.5 and a 3, a 2.75. I never know what size the words are going to be. I need, I have to have options. So we're going to continue on, and we see J45.30. That is mild, persistent asthma, uncomplicated. I like that. And look up under there. It's giving you also other ways you would see it, mild persistent asthma, not otherwise specified. So we know that that's where we need to be. So let's take a look. What is J45.31? What is that telling us? It is mild persistent asthma, but it is with an exacerbation. There's no mention of an exacerbation. This patient's mild persistent asthma is well controlled. So we're going to eliminate that. Okay. Remember, exacerbation, that means it's getting worse. That is definitely the opposite of well controlled. So we would eliminate B, and they are a smoker. Now, oftentimes when you have things that are related to the respiratory system, you always, anyway, regardless, you need to see if the boss is giving you some information. And indeed, it is. It's telling us to use an additional code to identify various things that could be related to tobacco. Well, tobacco use 272.0, this patient is a bit more involved with the cigarettes. It's a bit more extreme. Okay, it's a bit more going on. It's a bit more serious, I would say. Okay, they're not only using, they are dependent on these cigarettes. So we're going to code for that. F17.210, nicotine dependent on cigarettes. That is a more concise, a more specific code because they are dependent on the cigarettes, not only using. So we would eliminate D, and we're going to choose C. All right. Okay, yeah, you got to be forensic. I'm telling y'all, if it means getting, different pairs of glasses, or magnifying glass, or using the tip of your pen or your pencil to help guide your eye, do that. All right, so we have the next one. What are the correct ICD-10-CM codes for this encounter? We have A, J10.08, J14, J96.01, B, J96.00, and J13. C, J96.02, J13. Finally, D, J96.01 and J14. A 65-year-old male with a history of chronic obstructive pulmonary disease, or COPD, is admitted to the hospital in acute respiratory failure with hypoxia. On the third day of hospitalization, the patient was diagnosed with pneumonia and his sputum grew Haemophilus influenza. Again, what are the correct ICD-10 codes for this encounter? All right, coders, you know the drill. You've got 2.5 minutes to solve, and your time, it begins now. All right, coders. I'm seeing some good things. You guys are thinking it through. Some people are like, "Hey, wait a minute. I checked again. I didn't need that particular code. I'm on it. I'm on it." So we had a little bit of a mix between A and D, in fact. And so we're gonna get down here and take a look. We're gonna take a look at this one. All right. So the answer is D. It sure is. It's D. So you guys were getting there. I like that. I like that. So we have for our keywords COPD, they've been admitted in acute respiratory failure with hypoxia. They've been diagnosed with pneumonia. Okay, and in fact, the sputum culture grew Haemophilus influenza, so that is the causative organism. That's what's causing the pneumonia. So we're going to pull out acute respiratory failure with hypoxia as well as pneumonia with Haemophilus influenza. So we're going to go back to our acute respiratory failure, and you know what? My other code that I had over there, you don't need it. All right. So I took it out and didn't transpose that to this one. All right. So this one we're going to take a look here. We have J96.0, point 1, point 2, and just as before, that's going to help us narrow it down which coding category we should be in. We're going to eliminate the J14 just simply based on sequencing because the acute respiratory failure can be sequenced first as long as there are no chapter specific guidelines that would provide any type of sequencing that would take precedence. So when we take a look here at J96.00, that is acute respiratory failure unspecified whether or not it is hypoxic or with hypercapnia. We know that's not the case, and so we're going to eliminate that. And then J13, that's pneumonia due to Streptococcus pneumonia. This pneumonia was caused by Haemophilus influenza. So we're going to eliminate B, and we take a look at J96.02, acute respiratory failure with hypercapnia. That's when a patient has excessive carbon dioxide. So we're going to eliminate that one as well. And really, once we grab the J13, we could eliminate it because the pneumonia is not due to Streptococcus pneumonia. So there are various ways that you could take a look at it. Okay, so you could immediately eliminate B and C, right? So that leaves you with the A and D. So now it's a matter of sequencing. Okay, so you take a look here. J96.01, that's acute respiratory failure with hypoxia, which means that the patient has an oxygen deficiency. And then the causative agent is pneumonia due to Haemophilus influenza, J14. And so we're going to default to this guideline here that the acute respiratory failure is indeed the principal diagnosis. You might be saying, well, how do I know that they were admitted with it? That's what drove them there. And on the third day, they were diagnosed with the pneumonia. So we're going to follow up with J14 as well. These particular instructional notes here, none of these coding categories apply here. Any associated influenza or an associated abscess. So we're going to use this guideline here to drive us to D. All right. So yeah, I took it off on this one, but it does not change the code selection. Okay. All right. So we're going to keep moving along and take a look. I've got some more. I'm a Southern cook. I just keep, company comes over. I just keep cooking. So we're going to move to chapter 12, skin and subcutaneous tissues. And there are various things that can go, awry with the skin. So I always tell you, take a look at what is in each of these chapters. So we have diseases of the skin and subcutaneous tissue, which takes us through L00 through L99, and you have various things in there, infections of the skin, bullous disorders, dermatitis, and eczema. We're going to also be taking a look today, though, specifically other disorders of the skin and subcutaneous tissue, L80 through L99. pressure ulcers and non-pressure ulcers. This category also includes impetigo, furnicles, carbuncles, and abscesses, cellulitis, and lymphangitis. Why are they there? Because these are diseases or conditions that affect the skin. All right, so we're gonna keep rolling, and so I'm glad I see some people saying I understand it now, or yes, that is beautiful. So let's keep going. Here's some things to keep in mind. So you guys know I am very much a visual learner, and so I teach the way I learn. These pressure ulcers, you have to have a visual of what these stages mean. They're also referred to as bed sores or decubitus ulcers. Also, grab the terminology, common terminology that you will see. So when you are looking at scenarios, then you will be able to, really solve a bit better and really come to the right conclusion quicker and more efficiently. So a pressure ulcer could be a bed sore or referred to as a decubitus ulcer. Be aware of the stages. What does that mean? Stage one, it's a focal erythema, just reddening of the skin. Stage two, there's partial thickness loss involving the epidermis, the dermis, or both. Remember your terms. Remember the epidermis, that's on top. All right. So, and I'm sorry, the dermis is on top. The epidermis above, that's on top, and then the dermis is underneath. So you want to be aware of that. This epidermis, you've got some loss of skin, but now you're getting down just a little bit to the dermis. Okay, both of those can be involved. All right, so just a little bit more than focal erythema. Now we've got some skin loss, just a little. We move on to stage three. That's full thickness because now it is going from the epidermis, the dermis, and now we're touching on the subcutaneous tissue or the fat. You see how now that would be more severe because now you're getting into deeper layers of the skin. When you get to stage four, this is not only persistent focal erythema, but now we have necrosis of the soft tissue. So we have gone from the epidermis down through the dermis. We are now moving down past that fat layer or the subcutaneous tissue. Now we're getting down to muscle and bone. This is muscle and bone. You see like these little lines of striations and stuff. Okay, that's the muscle and then the bone. That's getting real serious. And you can see why oftentimes these need to be controlled and why you often deal with infections as well, because you think of your skin as nature's coat. Okay, and you think of the skin as that is your coat. And also someone was asking about Eshar. That's like nature's band-aid. Okay. All right. So we're going to keep on going with the key terms. So now if a patient has an unstageable ulcer and it's L89 point dash dash zero. So what you want to pay attention to is the L89 and it ends in zero. This stage is undetermined. That means that based on the clinical documentation that the provider can't determine the stage because you're looking at skin, you're looking at a body. Like I saw someone in the chat, they had typed, like, how would you know? I thought that the stage would stay the same. You're talking about now when you're coding, that's what makes it so dynamic. You're talking about a human body and a human condition. So we can't tell that body, you stay stage two, because that's what I'm coding you as. You a stage two. You stay there. Don't you evolve past stage three, maybe, because that's what I got in my book. All right. So what about if it is an unspecified ulcer? Well, that just simply means that the stage is not specified. Okay, so if you see unspecified ulcer, or if you're not given any information on it, then it's going to be L89 dot dot, and then it's going to end in 9. So that's the thing, the takeaway. Unstageable L89, it ends in 0. L89 and it ends in 9, that's unspecified. So those are two different things. Gangrene, that is a condition that occurs when the body tissue dies, right? So you'll see like a person will have, say, like frostbite and they're losing fingers or toes and it becomes black. Think about it. There's no longer any circulation getting there. Okay, you need the circulation in the blood for that tissue to stay warm, for it to get nutrients and take various trash and different things away, waste away. When it's no longer doing that, the tissue's dying because it's not getting oxygen that it needs in order to live. So let's take a look at some exercises. Okay, so we have a straightforward one. All right, we're gonna start you off slow and we're gonna build on it. You know how we like to. We're building a sandwich. This is a sub sandwich, I guess. Yeah, yeah. Okay, so we're gonna select some diagnosis code or codes, and we have A L97.409, B L89.619, C L89.610, L89.620, and finally D L89.619 and L89.629. A patient is diagnosed with pressure ulcers on each heel. Select the diagnosis code or codes. All right, you've got 2.5 minutes and your time. It starts now. You all are doing phenomenal. I know you guys have been spending time with this material and you definitely understood the takeaway about how to quickly determine if something is unstageable or if it is unspecified. So let's take a look. Yeah, the answer is D. Okay, so I had a few takers with the C, and that's okay. We're gonna give you that little nudge. So let's look at these codes. Pressure ulcer on each heel. All right. So if it is unspecified, because it is, we don't know what stage it is. We're going to hone in on L89 and it ends in 9. As soon as we do that, we could just about we could eliminate at least one on site, and that would be C. It sure would. It would be C. All right. So yeah, and with this one, we wouldn't know we could take it away until we get over there because we don't know if there is a bilateral code. So we wouldn't know yet, okay? But we already know, okay, we're going to be looking at B and D based on L89, and it ends in 9. Okay, because this is L97, it's ending in 9, but that's 97. All right, and this one right here, L89, but it's not ending as it should. Okay, so we get over here in L97.4, that is a non-pressure ulcer, and we are dealing with a pressure ulcer on each of this patient's heels. So L97.409, that is eliminated. We continue on and we take a look at L89.61. This is a pressure ulcer of the right heel, but it is unstageable. There's no reference to it being unstageable. It's simply not given to us. The information is not given to us as far as the specifics of this ulcer. So it is not unstageable, it's unspecified. So we are looking for L89.619 for pressure ulcer of the right heel, unspecified. Well, this tells me, hey, if we need laterality and there is not a combination code to record both, what do we have to do? We have to use each code, all right, in order to capture what's going on here. So each heel, so we're going to also follow that up with L89.629, pressure ulcer of left heel, unspecified stage. So that eliminates B. We're on the right track, but we've got to record or document rather for both heels. So that pushes us to D. Yeah, yeah, I know. It is easy to get unspecified and unstageable get it crossed. So definitely jot down those definitions like at the beginning of these chapter specific guidelines to keep you straight. You could even put it up at the top when you are in the code specific areas to just kind of keep you on track and give you a nudge. I know I do that for various things in my manual as well to keep me straight. All right, so we've got some more. I told you I'm still cooking. I'm still cooking, y'all. I'm still cooking. We're gonna be so full. So here we go with our next example. All right, so I want you guys to let me see how I have this situated here. Uh, all right. Okay. All right. I restructured this. I was like, I made that bigger. Okay, so we're going to start out with this one. I'm going to give you 2 minutes to solve this one. And I want you guys to give me the code for pressure ulcer ankle stage 1. All right, your time, it begins now. All right, coders, let's do the reveal. Yeah, it is L89.501, ulcer pressure ankle. Yeah, it sure is. So let's go ahead and take a look. All right, so we have our order of doing things. How do we get there? We're going to go to the alphabetic index and we're going to look up ulcer and we're going to scroll down to pressure. Specifically, we are looking for stage one. Okay, so it's telling you what type of ulcer it is. It is a stage one. Whenever we start talking about specificity, because I'm glad someone asked that in the chat, like, hey, the right and left, that is laterality. But as far as the specificity of the ulcer, that is referring to the stage. Is that given to you? Is it stage one, two, or whatnot? And this is given to us. Okay. So we start with ulcer pressure, stage one. Specifically, we're looking for the ankle. And so that's going to bring us to L89.5. We've got the check mark. We know we've got a bit more work to do, and we're going to complete this code over in the tabular index. So we're going to go over to the tabular and verify and read all of our notes. We know we're at L89, specifically L89.5, pressure ankle of the ankle. And we have L89.501 because now we're capturing pressure ulcer of unspecified ankle. We don't know if it's the right or left ankle, but we do know it is stage one. Okay. All right. So there we go. L89.501. Okay. All right. Okay. So we're going to keep on moving. And we're going to code for pressure ulcer unstageable face. So you've got 2 minutes again, and your time, it starts now. All right, I'm loving it. I'm loving it. You guys are doing some amazing work in the chat. And I tell your team, thank you for taking care of them. They are in there engaging with you guys, and y'all are on fire. It's hot in here, y'all. It's hot in here. So we have L89.810, ulcer pressure face. All right, so let's take a look. We're going to look up ulcer in the index as before. We are specifically looking under pressure and unstageable this time. We're going to go down to the face, and that is giving us our code L89.815. followed by a dash and a check. So that's telling us, hey, we better get over to that tabular index so that we can complete this code and verify some things. We are in L89. We continue on L89.8 and then L89.81, pressure ulcer of the head, pressure ulcer of face. All right. So what do we need now? We've got to do what? We've got to move on down because it's telling us we need six. So we got to what? Keep going. So we have L89.810, pressure ulcer of head unstageable. And you guys were on it. Y'all were on it. L89.810. Y'all are, look here, I'm celebrating. I'm doing the happy dance. Y'all gonna make me raise my Vera dance, okay? I need to be standing. I need to be standing. Here we go, guys. We've got pressure ulcer, stage 4, left heel. You've got 2 minutes to solve this one as well, coders, and your time, it begins now. All right, y'all are doing it. Y'all are doing it. I tell you, y'all are keeping the team busy in the chat, and you all are really, really digging in today. So let's take a look. Y'all were there. Y'all are spot on. It is L89.624. L89.624. Let's do that again. Ulcer, pressure, heal. So you all know the drill. We're going to look up ulcer in the index, scroll down to pressure, and specifically, we are looking for stage 4 of the heel, and that leads us to L89.6. We've got our check mark that's telling us, hey, head on over to that tabular list so we can verify some things. So indeed, we do that, and we get over here to the L89 category for pressure ulcer. We move down to L89.6, pressure ulcer of heel, and specifically, we need an additional some additional digits. We have L89.60, pressure ulcer of unspecified heel, and we move here to L89.61, pressure ulcer of right heel, and then we continue on L89.62, pressure ulcer of left heel, and it tells us, hey, keep moving. We need 6 digits. Now we have not only the specific stage, okay, we also have the laterality of the left heel. So again, coding to provider certainty and specificity. So that leads us to L89.624, pressure ulcer of left heel, stage 4. And y'all were on it. Y'all are on it. All right, coders, let's continue on with our discussion concerning pressure ulcers. So let's move along and talk about now evolving ulcers. And again, reminding you to pay attention to this particular guideline. I'm going to give it to you after we talk about this statement again. Want to be sure you're clear on this, true or false. When coding evolving an evolving ulcer, we only code the highest stage during the admission. So I want to hear from you guys in the chat and tell me, uh, do we only code the highest stage during the admission? All right, so I'm going to give you guys a few moments to pop your answers in the chat. This is simply true or false, and then we're gonna chit chat about it just a little bit more. All right, so I think many of you are getting there. Okay, so yeah, when we are coding an evolving ulcer, all right, and this is coming from our guideline C12.A.6, that is false. We do not only code the highest stage during the admission. Remember, how many codes do we need to code for? We have to have two codes. Two codes are required with the following sequencing order. In fact, the first code has to be the stage that is present on admission, or the POA, followed by the highest stage during the admission, right? So I want to be sure you guys are clear on this. If it's not sequenced this way in your MCG manual, please make this correction, as well as when you tap in your manual, you're jotting this down. Be sure that you sequence first the ulcer stage on admission, followed by the highest stage during the admission. So let's go ahead and take a look at two scenarios, and then we'll further explore this, and be sure that you're clear on this particular concept. So let's take a look. Now, what stages, because we know it's going to be a stage. I have stage or stages, but you know, because it's evolving, that you're going to need two. That's the primary thing. That is rule number one, right? So let's talk about this scenario. Anna is admitted with a stage 2 pressure ulcer, and the next day it evolves into a stage 4 pressure ulcer. And upon discharge, it's a stage 1. So what stages would we code? I'm going to give you 1.5 minutes to solve, and your time, it begins now, coders. All right, so let's take a look. Now, we have stage 2 and stage 4. That would be our sequencing order. Now, we take a look at our keywords: admitted, stage 2 pressure ulcer. The next day, it evolves into stage 4. And upon discharge, it's a stage 1. And we simply follow our sequencing order. First is the stage POA, or present on admission. It was indeed a stage 4 when she was admitted. It evolved into a stage. It was, let me correct myself. When she was admitted, it was indeed a stage 2, and that would be first, followed by what it evolved to into, which was a stage 4. That is the highest stage. So we're going to sequence it accordingly. Stage 2, that was present on admission, followed by stage 4, which was the highest stage that the pressure ulcer evolved to during the admission. So let's take a look at another. Now, with this one, again, what stages would we code? We know that there's two. We're going to go ahead and just let the cat out of the bag. I want to be sure you got this. So we're going to take a look at this one. And indeed, this patient was admitted with a stage 3 pressure ulcer. And over the next 4 days, it evolved into a stage 5 pressure ulcer. Upon discharge, it's a stage 2. Again, what stages would we code? All right, so I'm going to give you 1.5 minutes to solve. I don't think you'll need it. I'm sure, yeah, some of you are already popping answers in the chat, but I'm going to give you 1.5 minutes uh, to do this one anyway. So your time, it begins now. Beautiful job. Beautiful job. I'm loving what I'm seeing, and it's very apparent that you guys have a very firm grasp of how to code evolving ulcers. So, yeah, just like before, we're going to follow those sequencing guidelines that we have. So, we have that the patient was admitted, have the stage 3 pressure ulcer. It evolved into a stage 5, and on discharge, it was a stage 2. So, yes, just like our guidelines, we're going to capture the ulcer that was present on admission, which was stage 3. She was admitted. It evolved into a stage 5. We're going to sequence that second. That's our highest stage during the patient's admission. And so there's our order: stage 3, followed by stage 5. You guys are doing fabulous. And I can tell you have a firm grasp of coding evolving ulcers. So we're going to continue on with our next scenario. Now we have Henry coming into the ER, and we're going to code for Henry. So we have A, L23.89, B, L23.9, C, L25.9, and D, L25.3. Henry visited the ER with complaints of excessive itching and swelling in the trunk area. The review of systems uncovered that Henry has been experiencing these symptoms ever since changing his laundry detergent. The ED physician diagnosed Henry with allergic contact dermatitis due to detergents. All right, so I want you guys to take a go at this. You've got 2.5 minutes to solve, and your time, it begins now. All right, coders. So I'm seeing some good things in here. This one is rather straightforward. So your answer is A. Yeah, it is A. So I had a few outliers there. So some of you were grabbing B and D and just a little bit of a sprinkling. So we're gonna go ahead and talk about this one and get everybody on the same page. So for our keywords, we have itching and swelling, and they have been diagnosed with allergic contact dermatitis due to detergents. So we've got to keep in mind specificity. So we already know we're going to take a look here at this coding category, L23. This is allergic contact dermatitis. And then L25 is coding for unspecified contact dermatitis. Okay, we have a specific dermatitis. It is allergic contact dermatitis due to detergents. All right, so we're going to eliminate C and D. right? So we already know it's allergic contact dermatitis. So if you chose C or D, remember you've got to be forensic. You have, when you look at these coding categories, L23 versus L25, allergic contact dermatitis, start matching up. Oftentimes it is a matter of matching up these keywords. That's spot on. Unspecified? No, not in this case. We know it's allergic. All right, so we're going to eliminate those and continue on. All right, and it's telling you right here, even when if you chose this, you've got to look at everything that's related to that boss. It's telling you excludes allergic contact dermatitis L23. What does the excludes one tell you? Don't code that here. Okay, don't code that there. All right, so we're going to keep on. L23, L23.8, allergic contact dermatitis due to other agents. L23.89, allergic contact dermatitis due to other agents, allergic contact eczema. All right. And then L23.9, allergic contact dermatitis, unspecified cause. So we know what the cause is. It is due to the detergent. So we are going to eliminate L23.9, and that pushes us here to L23.89, allergic contact dermatitis due to other agents. And that is your code. You are going to code and choose the best answer. And that is the best answer because we do know the cause. The ED physician has determined that it is allergic contact dermatitis and it is due to a detergent. So we know the cause. Okay. All right. All right. So we are going to keep on going and talk about our next one. All right. So, muscles, pathological fractures. All right. So, if any of you still have questions about certain things that we're talking about, please email Mr. Sandeep or myself, and we'll be glad to help. Okay. We want you focused on what's right here. So just put a pin in it, and we'll be glad to help you. Send us an email. Okay. All right. So, we're going to keep on rolling. Key terms and definitions. Pathological fractures, that's a broken bone. It's a broken bone that occurs in the area of a weakened bone. All right. Osteoporosis, that's a bone disease that decreases bone density. So be sure you grab that, okay? Pathological fracture, a broken bone, it's occurring in an area of a weakened bone, often because of some type of pathological process that is going on that is causing the bone to weaken. Osteoporosis, the density of the bone is decreasing. Hence, osteoporosis, you think of holes in the bone, okay? All right, so osteoporosis with versus without a current pathological fracture. Now, what is the difference with a current pathological fracture? If the patient has a current pathological fracture at the time of the encounter, you're going to identify the site of the fracture, and this code, M80 point whatever will follow, should be used even if the patient had a minor fall or trauma. If that fall or trauma would not usually break a normal healthy bone, then you would use M80. Okay, so it's a matter of, is it a current pathological fracture, the site, and you have to determine if the fall or trauma would usually not break a normal bone because the bone is very fragile. Now, if it's without a current pathological fracture, this is for patients with osteoporosis who do not currently have a pathological fracture. Any fracture in the past is not accounted for. That makes sense because we are capturing things after the diagnosis. So you would use M81 followed by whatever is specific for that code. All right, so just giving you a look when you go into your alphabetic index, a way to keep yourself organized, to be sure you're where you should be, because you could pick up the right body location and all of that good stuff, but you could be under the incorrect heading. So, what you might want to do is go over there. You'll see osteoporosis, male or female. M81. If you go down with current pathological fracture, I chose red because I'm thinking that could be serious. So red to help distinguish and guide my eye. If it is age related, you're back to the 81.0. If it's with a current pathological fracture, back to M80.00 and then follow it with your check. You continue to move along. You have disuse. This pushes you back to the M81 category. Again, with pathological fracture, back to M80. Postmenopausal, that's going to push you into the M81 category. With pathological fracture, back to M80. Specific type, not elsewhere classified, M81. If there is a pathological fracture, M80.0. So this is just to show you how, if it's a pathological fracture, where you're going to be, and if not, where you're going to be. So you want to definitely distinguish where you are in your manual, and you can do that for various categories. When you have multiple types of categories and subcategories and little subcategories up under there, you want some type of way to distinguish it so that you're clear that you're picking up the code from the proper source. Okay. All right. And so your provider is going to be, the provider will provide all of that. We are coders. We don't have to worry about how they come up with it. You are going to code what you see. You cannot document what is there. So we capture what we see. If it's not there as you move along, and if you need certain information, then that is when you would query a provider, but you code what you see. All right, so for our extender boxes, 7 character pathological fractures, if there is a non-union, that means that it didn't heal. Okay, it didn't unite. If there is a bad heal, meaning that the bones were trying to heal, but it's a malunion, meaning that it's off. It's healing, but it's not a very good heal, then it's a malunion. So you think about none, didn't heal. Mal, it's bad. Okay, it's not a very good union of the bones. All right, so coming up is Mr. Sandeep. He's got the mic, he's got the floor. Okay, the man with the plan. Come on, Mr. Sandeep.
Thank you, Miss Tamika, for all those beautiful scenarios and great instructions. So, meanwhile, I will just take the screen. And here we go, coders. Now, next, we are going to do some ICD-10 walkthrough exercise. So, let's get started. So, the exercise, let's look up the code for idiopathic gout of the left elbow. So, you can try, and we will walk along. We'll go along in this. So, what's the main term going to be for this code lookup? Mm, yes. Come on, coders. Let's make this one interactive. I want everyone participate here. Yes, the main term is going to be gout. So what's a subterm? Yes, you all are correct. The subterm for this one is going to be idiopathic. And where is the site? Excellent, excellent. See, you guys all are professional. I see someone went ahead and put the ICD code as well in the chat. Wow, you guys are amazing, really. Yes, the site is elbow and the laterality. Is this a right? Is this a left? Or exactly, it is unspecified. It is not mentioned, that means it is unspecified. So we have a main term gout, we have an idiopathic as subterm, and The site is elbow and the laterality is unspecified. And the code is going to be yes, you all have already placed it in the chat. The code is going to be M10.029. That is the code for idiopathic gout of the elbow, unspecified elbow, right? So next one on is an example: postmenopausal osteoporosis without current pathological fracture. So what is the main term here, Codis? Postmenopausal osteoporosis without current pathologic fracture. Mm-hmm. Yes, I also think the main term is going to be osteoporosis. Next question: what is the subterm? Phenomenal. Said it, you said it. It is going to be postmenopausal. And as Miss Tamika said, it is going to start with M81.0. Now, next we are going to verify M81.0 in the tabular list. So, what do you think, Otis? What is going to be the answer? Exactly, the final answer is M81.0. And the guideline which we refer here is C13.D1. So great, 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 great work. The next one we are having postmenopausal osteoporosis without current pathologic fracture. She also had her hip she also fractured her hip 10 years ago and it is fully healed now. So what will be the main term for this scenario? Again, yes, again this is going to be osteoporosis. And how about the subterm? Yes, once again, it is going to be postmenopausal and it's going to start with M81.0. And there is another statement which says that she also fractured her hip 10 years ago and it is healed now. So are we going to do something extra for here? Extra for this? What will be the code? Mhm. I'm seeing some wonderful answers in the chat. Exactly, you said it's correct. So there is a guideline C13.D1 which asks us to code the history of personal history of osteoporosis fracture, if any, right? So we are also going to assign that code. We are also going to assign that history code along with M81.0. So the final answer is going to be M81.0 Z87.310, which is the code for the fracture history. So how are you all feeling, coders? Are you feeling good? The code lookup? Good. Great to hear. Great to hear. So next we are having some ICD-10 flip exercises. And you got 2.5 minutes to solve this one. So your options are option A, M81.0, M80.851A, M80.051A, M84.551A. How would you code a new pathologic fracture of right femur due to postmenopausal osteoporosis? So you got 2.5 minutes to put your answers in the chat, and let's do this one, Chorus. So that is time. And let me have a look into the chat. So I think we are having a mixed answer here. There's a mix up between B and C. Okay. I will help you. I will help you to eliminate wrong answer here. So the correct answer for this scenario is going to be option C, and these are our keywords as a new pathological fracture of the right femur, and it is due to postmenopausal osteoporosis. So we are having our guidelines listed over here in the bottom. So you can see MAT is the first code which we are going to code if the osteoporosis is with current pathological fracture, and MAT1 is the code series which we are going to assign if the osteoporosis is without current pathological fracture. And if you have a look into the question, we are having a pathological fracture, right? This is a new pathological fracture, so it's a current pathological fracture. So MAT1 is wrong, and we can eliminate option A and as well as option D, because we are already decided, we already seen that M80 is the first code which we will assign when there is an osteoporosis with current pathological fracture. So option D is also wrong. Now the question is between option B and option C. Let's have a look into those two codes. And here there is a seventh character which is to be assigned depending upon whether it's an initial encounter for the fracture or a subsequent encounter. Well, in our scenario we saw that the patient is having a new pathological fracture, so this is going to be an initial encounter, so we are going to assign A as the seventh character. And let us have a look into the next, the code A and code B. Option B and option C, and I think option C is coding for age-related osteoporosis with current pathological fracture of right femur, and we are having M80.851, which is coding for other osteoporosis with current pathological fracture of the right femur. So, well, option B is wrong. It is coding for other osteoporosis, and if you have a look into the terms which they have mentioned under M80.0, it is saying it is coding for M80.0. It includes the postmenopausal osteoporosis with current pathologic fracture, right? So this is exactly what our scenario is coding for. So you have to pick the correct answer, and that will be M80.051A. How are you all doing on this one, Goddess? So does the explanation help? Great. Great job, coders. So I think it was a aha moment for few of you. Well, most of you have done great jobs. So let's move on. Let's move on to the next one. We are having a Okay, I've read out the answers first. Option A is coding for M80.059D, M84.68XD, option B M80.059A, option C M80.059D, and we are having option D M80.059A, M84.68XD. A 90-year-old male returns to the physician's office for the treatment of a pathological fracture of thigh bone. He has no history of prior trauma to the area or previous falls. So you got 2.5 minutes, coders, and your time begins now. And that is again 2.5 minutes. Let me have a look into the chat. Mm, okay. So I think you all have done a good job here for this scenario. Yes, that's good work, coders. So let's solve this one together. The correct answer is going to be option C. And this is how we solve it. The keywords: a 90-year-old male returns to the office for the treatment of pathological fracture of the thigh bone. So keyword is patient is returning to the physician's office. So we have a guideline which states osteoporosis with pathological fracture. We are going to code M80.0 series first. And these are our code series. So as I said, since the patient is returning to the physician's office, it is going to be a subsequent encounter, right? We are going to give the seventh character as D, since the patient is returning. Yes, that's a keyword here to look into. So any answer with the seventh character A is wrong. So we can eliminate option B here. So remaining options are option A, C, and D. And if you look into option D as well, there is two sets of codes. One is coding with the seventh character A, and another one is coding with the seventh character D. So as we already decided, seventh character A is wrong for this encounter. So option D and option D is wrong. So remaining two options are C and A. Now we have to decide between C and A, and these are the codes. So we are having M80.059, which is coding for age-related osteoporosis with current pathological fracture, unspecified femur. And we are having M84.68, which is coding for a pathological fracture in other disease, other side. So if you're having already age-related, a code with an age-related osteoporosis with current pathological fracture, is that necessary to give another code, another additional code that again indicates a pathological fracture that is in other disease, in other site? What do you think, coders? Is that required? Yes, it is not required because one code it is explaining everything to us, right? M80.059D is explaining everything. Yes. So we don't need two sets of codes here. So option A is wrong. And the correct one is going to be option C, M80.059D. Okay, coders, how are you feeling on this one? Do you need any more clarifications? Are you feeling good? Are you feeling okay? Please let me know in the chat. Good to know. Good to know. Yeah, everyone is feeling good. Okay, feeling great. So I think it's time to move on to the next scenario. Again, you got 25 minutes to solve this one. This one has no options with you. So you have to pick up the correct answer. And you got 2.5 minutes for this one. So I will read out the scenario for you. What is the ICD-10-CM codes used for the above scenario? A 65-year-old with a history of COPD presents to the emergency department with SOB, fever, and cough. He has been experiencing these symptoms for past 3 days. The physical examination patient's temperature is around 102 degree Fahrenheit. His heart rate is 110 beats per minute, and his respiratory rate is 24 breaths per minute. He has a decreased breath sounds bilaterally and crackles in the right lower lobe. Laboratory test: the patient's WBC is elevated at 15,000 cells per mm3, and his chest x-rays shows right pneumonia. Diagnosis: patient is diagnosed with COPD with pneumonia, and the treatment: patient is admitted to the hospital and started on IV antibiotics. He is also given oxygen therapy and bronchodilator. So, what is the ICD-10-CM code used for the above scenario? So, I've already highlighted the diagnosis of the patient. It is going to be COPD with pneumonia. So, your 2.5 minutes starts, Codus. Okay, time's up, Codus. Let me have a quick look into the chat. This is going to be a good one. I can see some great answers out there. Okay, Codus. So let's do this together. So the correct answer for this one is going to be J44.0 and J18.9. Yeah, I can see a lot of correct answers here. So the keywords. So the keywords is going to be a 65-year-old COPD, and patient came with a shortness of breath, fever, cough, and the x-ray shows pneumonia. And finally, doctor has diagnosed the patient with COPD with pneumonia. So how are we going to look up for the code? We will be going to the disease, and then we will be going to the lungs over here. Then we will go to the obstructive chronic, because the patient is having COPD, right? It's a chronic obstructive pulmonary disease. So we will go to the obstructive chronic J44.9. And then if we look further, it is going on like obstructive with, we are having a pneumonia over here, and pneumonia is a lower respiratory tract infection. So we are not going to code for J44.9. We have to go further below, and we have to select a COPD with lower respiratory infection. That will lead us to J44.0. And well, are we going to stop over here? No, right? Because it is not the end. You have a guideline which is saying, asking us to code also the identify the infection code. So we have to go and code for the infection as well. So here it's a pneumonia, and we're having unspecified organism. So we will be coding J18.9. So the code for this one is going to be J44.0 and J18.9. That's fine. That's understandable. You have to look up for the code. So it's okay that you understood and you also selected the code. That's a great thing. So how are you, code? How are you all feeling, coders? Was this a good one? Okay, if you need any clarifications, please place in the chat. We'll be replying to them. And I have, let me see. Yes, I've got one more scenario for you. And the question is, I'll read out the options for this one: J95.851, option B J18.9, option C is going to be J95.851, J44.0, J18.9, option D none of the above. Patient 75-year-old male with a history of chronic obstructive pulmonary disease is admitted to the hospital with pneumonia. He has been on ventilator for past 3 days and given antibiotics. So what is the answer? What is ICD code for this scenario? And I think you don't need 2.5 minutes. This is pretty straightforward. Let's see. Let me see how fast you all are going to solve this one. And Coda, that's 2.5 minutes. And I think from the chat which I'm seeing, this was an interesting scenario, and I can see lot of mixed answers in the chat. And let's highlight the keywords here. Patient is a 75-year-old male with a history of COPD and pneumonia. And the correct answer is going to be option D. Yes, out of all the four options, the correct one is going to be option D, none of the above, because this is a guideline related scenario. If you remember, we went through this in the beginning. I'm sure Mr. Mika went through this in the beginning on the ventilator assisted pneumonia. If you can read from the MCG guidelines, we can see our MCG manual. You can see the guidelines for the documentation of ventilator associated pneumonia. As with all the procedure or procedure related complication, code assignment is based on the provider's documentation of the relationship between the condition and the procedure. The code J95.851, ventilator associated pneumonia, should be assigned only when the provider has documented ventilator associated pneumonia. And it goes and says the code J95.851 should not be assigned for the cases where the patient has pneumonia and is on mechanical ventilator, and the provider has not specifically stated that the pneumonia is ventilator associated pneumonia. If the documentation is unclear as to whether the patient has pneumonia that is a complication attributable to the mechanical ventilator, always query the provider. So that's what they say. Assign only when the doctor document, and do not code additional codes from the category J12 to J18 to identify the type of the pneumonia with J95.851. So what we have to do here is to query the physician, right? Because there is a pneumonia and the patient was on a ventilator. So the doctor hasn't specified whether this is a ventilator associated pneumonia as well. So since the guideline states us to query the physician to get a clarification on that, we will be doing what? Yes, we will be querying the provider whether it is a ventilator associated pneumonia or not, and further code accordingly. So that was a good one, I think so. Isn't it? That was a guideline related. Exactly. So I hope that was a teachable one, and I believe you won't forget this guideline. You are not going to forget this guideline for the exam as well. So that's all from me, and I'll be handing over to Mr. Mika again. Mr. Mika, it's all yours.
Thank you, Mr. Sandeep. I tell you, you've got everybody on their toes. So hey, those are the ones that make you think, because if the coders are like me, I'm like, wait a minute, one of these has got to be the answer. It can't be none of the above. It can't be. So definitely a phenomenal scenario, and giving everybody an opportunity to really trust the guidelines, because that is what's key, is really being able to put your hand and your eyes on the guidelines. So we have just a little bit more, and we're gonna start wrapping it up here. So we're moving along to diseases of the genital urinary system, and that is going to be between N00 through N99. So, for some key terms and definitions, and we've been visiting chronic kidney disease because oftentimes it's integral to other disease processes, which really reminds you that your body is made up of various systems. And if something goes wrong with one, oftentimes it can have an effect on the other systems around it. And so, with chronic kidney disease, it's a condition characterized by a gradual loss of kidney function over time. And as you see with the stages, with stage one, you've got 90%, give or take, some a little over. You've got some kidney damage, but the kidney is functioning normally. With stage two, you're at 89 to 60%. You have some kidney damage, but there's mild loss of function. And then with stage three, you're at 59 to 30%, moderate to severe loss of function. Once a patient starts getting into stage four, 29, 15% of ability to filtrate and function normally. They have a severe loss of function at that point. And with stage 5 or below 15%, like you are, nothing's going on. Kidney failure, need treatment to live because the kidneys are no longer filtering, not actively doing what they need to do. So remember, if both the stage of chronic kidney disease and end stage disease is documented, then you're simply going to document the end stage renal disease only, the N18.6. So if you have both the stage of chronic kidney disease and end stage, then the end stage is going to take precedence. So let's move along with a few exercises. So select the diagnosis code or codes for the following. We have A, N40.0, R39.15, B, N40.1, R35.0, C, N40.1, R39.15, and finally D, N40.1. A patient diagnosed with BPH presents with urinary urgency. Select the diagnosis codes. All right, coders, you've got 2.5 minutes and your time, it begins now. All right, coders, you guys are on it. So we're gonna walk this one through, and the answer is indeed C. So I see a lot of things in the chat. All right, so I'm liking it. I'm liking it. Okay, I see a lot of good answers. Okay, so just a few folks that are answering otherwise, but I'm pretty sure it won't take long to nudge you in the right direction. This patient has BPH along with urinary urgency. All right, so BPH is benign prostatic hyperplasia. Okay, so that makes sense. If the prostate is giving this particular gentleman and fits and it's enlarging, it makes sense that they could experience urgency. So BPH falls up under this. And so we know that we are looking for something in the N40 category, and we take a look at N40.0. That is BPH without lower urinary tract symptoms, and this patient indeed has lower urinary tract symptoms. So we are going to eliminate A. This pushes us to these last three. Now we know that D would not be an answer because they don't just have BPH, but they, with symptoms, we've got to say what those symptoms are. We've got a code for the additional symptoms, and it's telling us, hey, if they have urinary urgency, you're going to use R39.15 along with the N40.1. And so, therefore, we would eliminate D. We take a look at R35.0, that's frequency of micturition, and we know that that's not it. Okay. And then we have a look here, urgency of urination, and it's already given us that code there. Okay. So we need urgency. Again, it's close, but not exactly what we need. So there we have it right there. And so we're going to code first the BPH, followed by the urinary urgency. So first and then second, this leads us to C. All right. Okay, so we're going to keep on moving with it. What are the correct diagnosis codes? And we have A, Q62.0, N13.30, B, N13.30, Q62.0, C, N13.30, and finally D, Q62.0. A 55-year-old female with right hydronephrosis presents for a cystourethropy with a retrograde pyelogram. What is the correct diagnosis? All right, coders, you've got 2.5 minutes, and your time, it begins now. All right. Yes, you guys could solve this one. Somebody found the secret sauce, okay? So, what is the correct diagnosis? Well, we are simply coding for right hydronephrosis. So, what do the Q codes tell you? Okay, what does that tell you? We're talking about a congenital diagnostic code. So, it would be something that has been present from birth, and we don't have any documentation saying that this is congenital hydronephrosis. So, we could eliminate everything but C. Okay. And I know somebody saying, "Hey, I'm trying to figure out the laterality if it's right, and if it's right hydronephrosis. I don't see anything addressing that." We have to code and select the best answer that we have in front of us. Okay, so we're teaching you coding, and we're also teaching you when you're on the exam, you got to code what is best. All right, based on what you have in front of you, and indeed it is C. And so for our keywords, we have 55-year-old. They have right hydronephrosis. And so we're simply going to take a look at the Q codes anyway. Q 62.0 congenital hydronephrosis. Boom, we're eliminating it. That's in each one of them. All right, so boom, they're gone. Now we take a look at the N13.30 unspecified hydronephrosis. Okay, so if we don't know what other type of hydronephrosis is it you know, crossing, like they're specifying crossing vessel hydronephrosis and that type of thing. We don't have any other specifics of the type of hydronephrosis, so it is unspecified. Okay, all right, so there we have it. So in 13.30, all right, so it's going to be other or unspecified. So I think many of you got there. So don't get hung up. I know you're like, hey, what about the right? You will have some questions on your exam, and you're like, wait a minute, you got to choose what's best and look at what's in front of you. It cannot be any of the other codes. Okay, it could only be that one because the others are referring to a congenital abnormality. All right. Okay, so we are going to continue on. Yeah, don't let it trip you up. It is not uncommon on an exam. You'll see certain things, you'll see just a few of them. Don't get caught up. Choose the best thing in front of you. Okay. All right. So proud of you, okay? I really am. All of us, we see the work you guys are doing. Keep going. Keep doing what you're doing. It's good. It's a good thing, coders. You guys are amazing. Thank you so much, team. I appreciate you, Mr. Sandeep. Always a joy to join you. And I appreciate this phenomenal intern team and coders. We so appreciate you all coming prepared and ready to dig in with your questions and everything, and you continue to challenge us, and we appreciate that.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast, we're all around